In the ever-evolving world of healthcare, breakthrough treatments bring a glimmer of hope to those living with chronic conditions. One such groundbreaking treatment is Ocrevus, a game-changer in the realm of multiple sclerosis, MS therapy. With its unique mechanism of action, Ocrevus has transformed the landscape of MS treatment, offering patients a chance at a better quality of life. The introduction of Ocrevus represents a monumental step forward in the fight against MS. By specifically targeting the cells responsible for the immune system's attack on the central nervous system, Ocrevus effectively slows down the progression of MS and significantly reduces relapses. This remarkable medication has brought newfound hope to MS patients and their families, empowering them to reclaim their lives and pursue their dreams. With its proven efficacy and safety profile, Ocrevus has quickly become the go-to treatment for both relapsing and primary progressive forms of MS. This video delves deeper into the transformative power of Ocrevus for MS patients, exploring its benefits, potential side effects, and long-term impact. Join us as we unveil the hope that Ocrevus brings to those affected by MS and the ways in which it revolutionizes their journey towards a brighter future. Understanding multiple sclerosis, MS. Multiple sclerosis is a chronic autoimmune disease that affects the central nervous system. It occurs when the immune system mistakenly attacks the protective covering of nerve fibers, leading to communication problems between the brain and the rest of the body. This disruption can result in a wide range of symptoms, including fatigue, difficulty walking, numbness or tingling, muscle weakness, and problems with coordination and balance. The need for effective MS treatment is crucial, as the disease can have a significant impact on a person's quality of life. MS is a complex condition, and finding a therapy that effectively slows down disease progression, reduces relapses, and minimizes symptoms has been a challenge. Until the introduction of Ocrevus, treatment options for MS focused on managing symptoms rather than targeting the underlying cause of the disease. Introducing Ocrevus, a game-changer in MS treatment. Ocrevus, also known as Ocrelizumab, is a breakthrough medication that has revolutionized the treatment of MS. It is the first and only approved therapy for both relapsing and primary progressive forms of the disease. Developed by Genentech, a member of the Roche Group, Ocrevus offers a new approach to managing MS by specifically targeting B cells, a type of immune cell that plays a key role in the development of the disease. Unlike previous treatments, Ocrevus is administered through intravenous infusion every 6 months. By selectively depleting B cells, Ocrevus prevents them from attacking the central nervous system, slowing down disease progression and reducing the frequency of relapses. This targeted approach has shown remarkable efficacy in clinical trials, leading to its approval by regulatory authorities around the world. How Ocrevus works to combat MS. Ocrevus works by binding to CD20, a protein found on the surface of B cells. By doing so, it triggers the body's immune system to target and destroy these cells. This depletion of B cells reduces the inflammatory response in the central nervous system, preventing further damage to the myelin sheath and nerve fibers. The selective targeting of B cells is a significant advancement in the treatment of MS. Previous therapies aimed to suppress the entire immune system, which often resulted in increased susceptibility to infections and other adverse effects. Ocrevus, on the other hand, offers a more precise and effective approach by focusing on the specific cells involved in the immune system's attack on the central nervous system. Clinical trials and research findings. Extensive clinical trials have been conducted to assess the safety and efficacy of Ocrevus in patients with MS. These trials have shown promising results, demonstrating the medication's ability to significantly reduce disease activity, delay disability progression, and improve patients' quality of life. One pivotal clinical trial, known as OPERA-1 and OPERA-2, involved over 600 patients with relapsing remitting MS. The trial compared the effectiveness of Ocrevus with another commonly used MS treatment. The results showed that Ocrevus reduced the annual relapse rate by nearly 50% and significantly slowed down disability progression compared to the other treatment. Another pivotal trial, named ORATORIO, focused on primary progressive MS. This form of the disease typically lacks treatment options, making the introduction of Ocrevus even more significant. The trial involved over 700 patients and demonstrated that Ocrevus reduced the risk of disability progression, improved walking ability, and reduced the burden of disease activity. Ocrevus versus other MS treatments. Compared to other MS treatments, Ocrevus offers several advantages that make it a preferred choice for many patients and healthcare professionals. Traditional disease-modifying therapies, DMTs, often require frequent injections or oral administration, which can be inconvenient and lead to poor treatment adherence. Ocrevus, with its 6-monthly infusion schedule, provides a more convenient and manageable treatment option. Furthermore, Ocrevus is the first and only medication approved for primary progressive MS, filling a significant gap in treatment options for this form of the disease. Prior to Ocrevus, patients with primary progressive MS had limited therapeutic options, making the introduction of this medication a game-changer for their care. Success stories and patient testimonials. The impact of Ocrevus on the lives of MS patients has been nothing short of transformative. Countless success stories and patient testimonials attest to the life-changing effects of this medication. Patients who were once confined to wheelchairs have regained their mobility, allowing them to participate in activities they thought were no longer possible. Others have experienced a significant reduction in relapses, allowing them to live their lives with newfound freedom and hope. One such success story is Sarah, a 32-year-old woman diagnosed with relapsing remitting MS. Before starting Ocrevus, Sarah experienced frequent relapses that left her physically and emotionally drained. After beginning treatment with Ocrevus, Sarah noticed a remarkable improvement in her symptoms. She has been relapse-free for over a year and has regained her energy and zest for life. Sarah's story is just one example of how Ocrevus has the power to change lives and unleash hope for those living with MS. Potential side effects and considerations. Like any medication, Ocrevus does come with potential side effects. The most common side effects reported include infusion-related reactions, such as infusion-related skin reactions, flushing, and shortness of breath. These reactions are typically mild to moderate in severity and can be managed with pre-medication and close monitoring during infusions. In addition to infusion-related reactions, Ocrevus may also increase the risk of infections, including respiratory tract infections and herpes infections. Patients receiving Ocrevus should be closely monitored for signs of infection and advised to seek medical attention if any symptoms arise. It is essential for patients considering Ocrevus to discuss the potential risks and benefits with their healthcare provider. Each individual situation is unique, and a thorough evaluation of the patient's medical history and current health status should be taken into consideration before initiating treatment. Accessing Ocrevus, insurance coverage and affordability. Given the significant impact of Ocrevus on MS treatment, many patients and their families may wonder about the accessibility and affordability of this medication. Ocrevus is available by prescription and can be obtained through specialty pharmacies or infusion centers. However, the cost of the medication can be a barrier for some patients. Fortunately, many insurance plans cover Ocrevus, particularly for patients with relapsing remitting MS. It is advisable for patients to consult with their insurance provider to determine coverage options and potential out-of-pocket costs. Additionally, patient assistance programs may be available to help eligible individuals access Ocrevus at a reduced cost or even for free, depending on their financial situation. Conclusion: the future of MS treatment with Ocrevus. Ocrevus has proven to be a game-changer in the treatment of multiple sclerosis. Its unique mechanism of action, targeting B cells, has revolutionized the way we approach the disease, offering patients a chance at a better quality of life. Through extensive clinical trials and research findings, Ocrevus has demonstrated remarkable efficacy in reducing disease activity, slowing down disability progression, and improving patients' overall well-being. With its convenience, safety profile, and proven effectiveness, Ocrevus has quickly become a preferred treatment option for MS. The success stories and patient testimonials are a testament to the hope and transformation that Ocrevus brings into the lives of those affected by the disease. As we look towards the future, Ocrevus holds the promise of further advancements in MS treatment, bringing us closer to a world where MS is no longer a barrier to living a fulfilling life. Ocrevus has unleashed hope for MS patients, empowering them to reclaim their lives, pursue their dreams, and live each day to the fullest. With ongoing research and continued advancements in MS therapy, we can look forward to a brighter future where the burden of multiple sclerosis is significantly reduced and the hope for a cure becomes a reality. Thanks for watching.